The Minister of State for Health and Social Welfare, Dr. Tunji Alausa, has expressed need for healthcare system to create jobs to boost the GDP of the country. Dr. Alausa disclosed this during an address in a courtesy visit and presentation of a document on National Plan on Vaccine Research and Development and Local Production to him by the DG National Pharmacy of Research. Dr. Alausa says it's a template that would be practicalized, emphasized on the sustainability of the document into the future, stating that it fits into the President Bola Ahmed Tinubu's agenda.
We as a country, we cannot begin to thank this partnership, this effort that your government led via the EU to partner with the government. I knew it was COVID that triggered it, but it's now, it will be shocking for you today to know that today we produce less than 1% of our vaccine that we use in a country of 220 million. So with Bulgaria and EU partnering with us in this sector, it's a sector that is highly needed, very desirable. And I said earlier that the value of a friend is a friend that actually anticipates your needs. And before you even go to them, they come to you that, oh, we feel you, this is your need, we're ready in a very respectful and mutually beneficial manner to help, to support, to partner. So I'm commending your government, Ambassador, you personally, for taking the lead on this, helping to let your government know the value, and then working not beyond for your government alone, working through the entire European Union to get us on the center stage of vaccine research, development, and local production. The national plan that's been developed now is a base, is a template to what we will now use into the future, into the not too distant future. That will happen in months, hopefully. That's what we're hoping for. That we can now begin to practicalize in a such way that we can now begin to produce our own vaccine. And it just this fits into our President Bola Ahmed Tinubu agenda to completely revamp this country bottom up in a way that will be sustainable into the future. And this just gladdens me where we're here today. This is one of our cross enabler that we've, as a Minister of Health, has put together. We have a 4-pillar agenda on what we need to do to completely overhaul, reinvigorate, rejig our healthcare system into a part of sustainability years from now, decades from now.
He further appreciated Ambassador of Bulgaria, Dr. Yanko Yeknovof, for taking the lead on the research, urged Bulgarians for assistance to improving our research institutions, taking the population of Nigeria into cognizance.
I plan now to be self-sufficient in a vaccine production, local vaccine production. At this point, unfortunately, we're a country of 220 million. It's shocking and sad to know, very disappointing to us, as myself and Mr. Party leading the ministry, that we're producing less than 1% of our vaccine, literally not producing anything. We're importing everything. And vaccine should be one of the essential commodities that any country should produce. And we know we have a lot of development partners working in the space. They've helped us, but we have to build capacity. Today, if all our development partners leave the country today, we'll be in a bigger mess than where we started from. And research is one of the base. Actually, is the only base. It's the only base that we have to build a sustainable healthcare sector. If we don't have a research as a cost-cutting base, we cannot build a sustainable healthcare sector. And we've recognized that as government. And what I was saying before you, Representative, before you came in, was to thank the Ambassador Yanko for leading this effort, working with EU, within the ambit of EU, to partner with us. And now, we've developed this plan. Going forward, plan is a plan. This is just book. What matters to any average person on the street is that we can now domesticate vaccine production in our country. Number one will be which today, health is just not physical security, it's social security and national security. We can now begin to, okay, we now vet our own vaccine, we're producing it, and in the process, we're using it as a job creator. We're moving from looking at healthcare sector as a consumption into economic engine. Because if you look at healthcare sector, if you look at beyond, even manufacturing today, doesn't need as much manpower as in healthcare sector. The technology has put in robotics in place, but in healthcare sector, you and I, we still want to be cared by a nurse to touch us. We don't want robots to touch us. So if we are running this high unemployment rate, but with a very youthful population that's eager, very energized, brilliant to work, we have to use healthcare as an enabler of creating jobs to grow our GDP. And that's what this President Bola Ahmed Tinubu is determined to do, and that's the mandate he's giving us as ministers, more so in the Ministry of Health. We are using this as an economic driver of a country.
The European Ambassador Daniella Esopies says they are committed to seeing the request for funding comes to positive light, assures their full cooperation.
So I can reassure you that Bulgaria is what we are aiming to do is definitely a sustainable long-term partnership that will transcend throughout the years. So I'll be very happy to see this national plan implemented, and you have our full support for this. As I said, the EU itself is a very generous organization to Africa especially, and we've taken note of your requests for more funding. Nationally speaking, we are committed to see this request in the most positive light, and we will do what is appropriate in this regard. So, Honorable Minister, once again, thank you very much for having chosen Bulgaria as a partner in this project. I'm sure you will have many more opportunities to interact with Bulgaria on the healthcare, and I'm sure we will never disappoint you on this. My last point is that actually this project is not just a strategic partnership in the healthcare sector, but for us this is part of an overall agenda to boost and strengthen the relationship with Nigeria, as we see, as I said, a new administration thinking strategically and seeing Bulgaria as a partner. And as I said earlier, Bulgaria is now working on different projects with Nigeria of strategic importance in a political dialogue, defense, education, and I'm very happy that on the healthcare we are already reporting results.
And the national plan, as now we need to be implementing it, of course, but the national plan could not come at a better moment, because as I was meeting with the federal minister who is traveling to Brussels, he's also taking it to the highest level in the Commission, European Commission, to discuss the other parts of this, which is the manufacturing part of, I mean, when we do a plan, we have to put money in research, but then manufacturing must follow. And so it's a very good timing indeed. I can already announce, and I think you might be aware of it already, that we are going to invest 18 million in research and vaccines in some public research institutions and other implementing partners. And we'll be working very closely with your ministry and, of course, your public institutions on that. And we'll be working closely also in the Team Europe spirit with Bulgaria. Team Europe, manufacture of vaccines is a Team Europe initiative at Africa, at a continental level. So we have other partners at African level, but here the first and only Team Europe member is Bulgaria. So again, thank you, Ambassador, for doing that with us. It's a very important collaboration that we started. I heard also from Federal Minister that you were aiming at having a biomedical institute in the capital, and that's also something we could look into.
Comfort Olayinka.